And we interrupt your regularly scheduled programming as Governor Baker is providing an update on COVID-19 testing in the Bay State. His press conference is just beginning. Let's listen in.
To supply the Commonwealth with 26 million rapid antigen tests over the next 3 months. We expect to receive rolling shipments from this contract beginning this week. The timing and size of the shipments will vary a bit depending on international shipping and production variables. The tests will be prioritized to support K-12 education and childcare. We'll provide more details on how we plan to distribute these tests to these entities shortly. As we've said many times over the course of the past few months, rapid tests are convenient and efficient. They can be completed at home with results in just 15 minutes. They are also accurate in detecting when someone is about to infect others, and that's why our administration is prioritizing securing these tests. The 26 million tests come on top of the 2.1 million rapid tests that we gave to 102 cities and towns before the holidays, and the 200,000 tests we distributed to educators before they came back after the winter break. We also organized several statewide contracts that every city and town can tap into for municipalities to buy rapid tests in bulk on their own, and several have. We encourage other municipalities to take advantage of this resource as well. Today, the Department of Public Health also released a new public health advisory with respect to advising the public around when to get a COVID test. This has been the subject of much debate over the course of the past few weeks, and DPH felt it would be helpful to create some clarity around this particular issue, given the amount of testing that's going on generally. DPH advises residents to get a COVID test under 2 key scenarios. 1, if they're exhibiting COVID-19 symptoms, and 2, if they're a confirmed close contact of someone who has COVID-19 in line with DPH's updated isolation and quarantine guidelines. Remember, with the new quarantine guidelines, DPH recommends but doesn't require that all exposed individuals get a test 5 days after exposure. DPH's advisory also makes clear that rapid tests in most situations are a very good alternative to PCR tests. PCR tests are the ones frequently used at drive-through and on-site testing facilities. They can take up to 24 to 72 hours to produce results, while rapid tests, as I said before, can turn results around in 15 minutes. Rapid tests are highly accurate at determining when an individual is at their most transmissible period of COVID-19, and they have many advantages to PCR testing, especially at this point in the pandemic. Because of this, DPH advises that a positive COVID-19 rapid antigen test does not need to be confirmed with a PCR test. We've heard from many of our testing sites that they're seeing increasing volumes of people who are seeking PCR tests specifically because their employer or their school or their child care center is requiring a PCR test to return from isolation. To be clear, DPH doesn't recommend that employers or schools or child care providers require a test to return from isolation after having COVID. However, if they do require testing, DPH recommends they do not require a PCR test. We know that many testing sites have seen increased volumes over the past few weeks as we deal with this current surge. People seeking tests should remember that DPH advises that you should only get a test if you're symptomatic or a confirmed close contact. Vaccines and boosters work. The data on this is unassailable at this point in time. They've been a game changer with respect to this pandemic. Getting vaccinated and boosted remains your best possible protection from getting really sick. Testing has a specific use in combination with vaccines, and we hope that DPH's advisory will help people navigate this issue. Rapid tests are great tools, and with the deal to secure 26 million additional tests, it will be enormously helpful to our effort here in Massachusetts. But again, vaccinations remain our best tool. Doctors, nurses, and every medical institution are in agreement on this. The vaccines are safe and effective for adults and kids. Massachusetts continues to lead the nation in getting our residents vaccinated, with over 5.1 million residents fully vaccinated. And today, on average, Massachusetts is still administering between 40 and 50,000 shots a day. There is still steady demand out there. Today, I also plan to activate 500 members of the Massachusetts National Guard to continue to add support to our healthcare system, driven by staffing issues associated with Omicron. These members are on top of the 500 we activated earlier this month. These Guardsmen and women will join the ranks of soldiers already assisting our medical facilities. There's no question at this point in time that staffing remains an enormous challenge for many of these providers. This activation will alleviate some of the pressure in those places. It's important to remember, while there are many Guard members with medical training, not all of them have medical training. Many of them have other kinds of training. And for many of the Guard members with medical training, when they're not serving, they're working in a hospital or a long-term care facility or some other healthcare organization. So these deployments require time and attention and training before they can get to work if they don't come from the healthcare community to begin with. I can't tell you how grateful we are to the men and women of the Guard for stepping up once again to support the Commonwealth's response to COVID-19. Massachusetts, like virtually every other state in the country, has seen a significant rise in COVID cases over the past several weeks. We do have the tools here in Massachusetts, the most prominent among them, vaccinations, to protect ourselves. DPH data shows that breakthrough infections in vaccinated individuals very rarely result in serious illness. If you haven't gotten a vaccination or a booster, please book an appointment and get one now. We've opened 5 additional state-sponsored vaccine and booster sites over the course of the past several weeks, and each site has added hundreds of doses in capacity every day. The new sites are in some of the hardest-hit communities in the Commonwealth: Boston, Lynn, and Taunton. And parents, if you have questions, you should know that pediatricians across the country are vaccinating their own kids. And if you do have questions, you should talk to your doctor, your child's doctor, or a healthcare professional. Questions?
How long do you think the 26 million tests will last? Once you put them in the field, are you going to do another 26 million in February, or any guess how long it's going to take?
So, remember, the 26 million tests are expected to arrive on sort of a regular basis over the course of the next 90 days. So we expect we will see a regular supply available to us throughout January, February, and most of March. Given some of the...
And that was Governor Baker providing an update on COVID-19 testing. It sounds like there'll be $26 million in funding headed to the state for testing. To continue watching this press conference, you can download our free Western Mass News app.